this is a 76-year-old male, uncontrolled hypertension, diastolic heart failure. He had an intracranial bleed. This is just a case which we did 3 days ago. Post PCI he already had, and his BP is very uncontrolled hypertension. But now treated on cilnidipine, a diuretic, and ARD, 20 milligram BID is well controlled. This is just a FFR that we did on him to see any coronary artery disease or negative FFR. So all his LV dysfunction and diastolic heart failure was related to resistant uncontrolled hypertension. This is a 76-year-old male, hypertension, hypertrophic cardiomyopathy, heart failure, preserved EF, amyloidosis, ATTR type, underwent a PCI with CABG, first CABG with occluded graft after 10 years. I stented the lima in the right coronary. He's presently on empagliflozin, MRA, and cilnidipine, a very high-profile individual, well connected to the government of India. So this was his creatinine. This was his immunofixation parameters of amyloidosis, of microglobulins and immunoglobulins, which are all very high. And this was his, see the hypertrophy of the left ventricle, resistant hypertension, very severe hypertension. The septum was so thick, you can see also the diastolic dysfunction. And this is a pyrophosphate PT PET scan to diagnose amyloidosis. And he had an ATTR kind of amyloidosis with resistant hypertension. The 66-year-old male hypertensive patient with CKD comes from Gujarat. He had an LV hypertrophy. He was on CKD on dialysis, and we had to do his PCI because of he was a CKD patient with a creatinine of like 8, 9, 10 with a 5 ml contrast. In fact, I wanted to do the whole PCI on no contrast, but I landed up pre and post injecting 2 ml contrast. But I did the whole procedure with the wire Silvit, with a stent boost, with the IVS and FFR. And his hypertension, he's a CKD, is treated with cilnidipine 20 milligram BID, telmisartan 40 milligram BID, and metoprolol 50 milligram OD. His creat here is about 9.4, CKD with kidneys which are all shrunken, atrophied kidneys. And this was the case where we have created this wire Silvit and use a stent boost and an IVS and FFR to treat this patient. My last case is actually, I borrowed it from a colleague. His name is Dr. Finn. We met in Georgia 2 weeks ago. And he had a 76-year hypertensive patient which he presented with heart failure, who's on quadruple devices with quadruple medical therapy. So he's on guideline-directed medical therapy, ARNI, vericiguat for his hypertension. He's on he's on cilnidipine. And these are the multiple devices which he's on. So if you look at all the devices, he's on a CRT with ICD. And then he's already undergone 4-5 stents, which got occluded. You can see he's undergone a bypass surgery. And then he's also got a CardioMEMS, which is put in the pulmonary artery to monitor his pulmonary artery pressures. And in between, he had a heart failure with a dilated annulus and a severe MR. So a mitral clip has been put. And about 2 months back, he had a LVAD. So LVAD is where you have artificial heart pump for heart failure in advanced heart failure patients with uncontrolled hypertension. So let me summarize that hypertension is a rising prevalence globally, affecting the young population, and end organ damage is the heart, the kidney, and the brain, which is a crucial fallout of hypertension, and it must be addressed with early intervention. Because as I told you, we have 2.3 billion people on this planet who've got hypertension. Lifestyle modifications play a key role in the management of hypertension. Calcium channel blockers are one of the mainstays, and guideline recommended molecules. If you look at both the European 2023 and the AHA and ACC 2023, calcium channel blockers are now the key in the management, both the older and the new generation calcium channel blockers to manage hypertension. The older generation amlodipine, as we discussed, causes pedal edema, reflex tachycardia, a gradient in the glomeruli, a podocyte injury, proteinuria, hence have limitations. The fourth generation calcium channel blocker, cilnidipine, not only offers BP control, but also benefits in protecting the vulnerable end organs. Cilnidipine is the fourth generation novel calcium channel blocker that offers BP control, dilates the afferent and the efferent arterioles of the glomeruli and the kidneys, protects the podocyte of the glomerulus, suppresses sympathetic overactivity, and protects the crucial organ, the heart, the brain, and the kidney. Cilnidipine has been studied. Actually, it's a Japanese product. So the inventor met me. He had come down to Bombay, and we did a CME with him. And it's extensively used in Japan today, and also in India for renocardio patients or uncontrolled hypertension, and has beneficial impact on hypertension management and end organ protection with minimum side effects. Thank you so much for your patience.